If you think this is a problem, well, let me break it to you. You're probably going to have a problem with just about every healthcare system in the United States. One of the biggest problems in the healthcare industry is a reticence to share data, is an overzealous body of incumbents that feel like there should be no data sharing. This plays to the fear that the incumbents in the healthcare industry have preyed upon for years and years and years.
Person came out, I guess they're kind of like a Google whistleblower, saying, hey, Google, you have all these health records and this is bad. And basically it was with Ascension Health, which I believe is a top 5 healthcare provider in the United States. And they're saying, hey, Google actually has access to all of this electronic health record information, names, full details of millions of people, millions and millions of records, yada, yada, yada. And Google is doing this to create better products for the healthcare provider, create AI, train their algorithms, provide more intelligent products for the physicians in the practice, and so on and so forth, right? Google's not opening up this data like Apple Health can do with the patient's permission to open it up to other third-party developers. That's not what Google's doing. Google is using it purely within Google for their different products, AI, et cetera, to create value for the healthcare system. If you think this is a problem, well, let me break it to you. You're probably going to have a problem with just about every healthcare system in the United States. Because if they are not doing something like this with Google, I can pretty much guarantee you they're doing it with someone else. Now, there's a whole range of who that could be. I would throw pharma companies into that bucket. Absolutely. And other tech companies that have their own different initiatives. I'd probably say Microsoft has similar arrangements. Again, I don't have any kind of hard facts on this, but I'm pretty strongly able to say here, Microsoft, Apple certainly has been doing things beyond just the consumer patient-facing side of Apple Health. So this isn't just Ascension in a bubble here that's doing this as a one-off. And I can also guarantee you that Google has similar arrangements with other hospitals too. I don't really think this is a bad thing. I guess you could make the argument that they should scrub things like names and kind of basic information like that. I think there's an argument there, but the overall model here of saying, hey, we are a hospital, there's value in this data, and that's not our expertise. We're not very good at technology, and we're not very good at building AI and all of these new ways to look at providing value to who? To our physicians. And you really need to, the physicians need this stuff. And as we've spoken about, one of the biggest problems in the healthcare industry is a reticence to share data, is an overzealous body of incumbents that feel like there should be no data sharing. Yes, while this kind of quote unquote whistleblower might think that they're doing something very good, I actually think that this might have more harm than good, because this plays to the fear that the incumbents in the healthcare industry have preyed upon for years and years and years. That's why the 2 largest EMR companies, Epic and Cerner, which control over 50% of the EMR market, are still operating like a company in the 1990s, right? They're operating like Oracle pre-Salesforce, right? It's all on-premise software. There's no data sharing. There's no common way to open up your data through centralized APIs like Salesforce has to an app marketplace. If you want to get access to these hospitals' data, you need to do one-off integrations with every hospital. And that's expensive for the hospital to do that, which means you got to pay the hospital, because the hospital just can't afford this stuff. These hospitals operate on ultra-thin margins. There's a lot of over-consolidation in the industry. There's all these other things going on. Hospitals are in a tough spot. So I guarantee you there's money involved going from tech companies like Google to hospitals, pharma companies to hospitals to get access to this data. Because yes, selfishly, it helps that company, whether it's tech company or pharma company, improve the products or improve the research or improve the IP or the AI or whatever it is that they're working on internally. But it also now provides value down to the physician, which ultimately gets passed down to the patient. So look, I think we have a way too aggressive kind of just stigma in the United States around that there needs to be a complete lack of data sharing in the healthcare industry. I think there is some legitimacy around like shielding names and that kind of stuff from these records. But overall, this is a good thing. And this stuff needs to be happening. Oh, and by the way, you wouldn't have to have these crazy one-off deals with these hospitals if you actually had a modern electronic record system, thanks to Epic and Cerner. But the reason why Google and pharma companies and all these places have to do these crazy one-off deals is because all these hospitals are beholden to these crazy EMR companies that deliberately put these impediments in their way for this exact thing called data sharing, right? It's getting a lot of buzz. I kind of think it's a little overbaked. Hi, this is Alex from Winner Take All. Thanks for joining us. Hope you enjoyed the content. Feel free to leave a comment, ask us questions, and definitely make sure to join us on our next live stream.